There's a new microbe that's been on the news lately, and it is Streptococcus, specifically Group A Streptococcus. This bacteria is typically found on the skin or in the throat, and it can also cause a variety of skin, soft tissue, and respiratory tract infections. And these can be between mild and life-threatening. These include tonsillitis, sore throat, scarlet fever, impetigo, cellulitis, and pneumonia. For Group A Streptococcus infections, these are usually less common but more severe, and they include necrotizing fasciitis and streptococcal toxic shock syndrome. These infections typically tend to infect the elderly, really young children, as well as people that are immunocompromised. This bacteria typically spreads with contact with nose and throat discharges of an infected individual, as well as skin lesions from an infected individual. Group A Streptococcus infections are usually a little more severe and can be life-threatening just because it means the bacteria has spread to multiple parts of your body. These include the blood, deep muscle, fat tissue, as well as the lungs. Early symptoms of necrotizing fasciitis include high fever, severe pain, swelling, and redness at the wound site. Early signs of toxic shock syndrome include fever, dizziness, confusion, low blood pressure, rash, and severe abdominal pain. The good news is that most people that come in contact with this bacteria typically just have a routine skin or throat infection that they can clear up on their own, but if needed, it can be treated with antibiotics such as penicillin. In order to prevent the spread of strep A, you should be 1. Washing your hands, especially after coughing or sneezing, 2. Staying home if you're sick, and 3. Making sure all of your wound sites are clean and also checking them for infection regularly. And this has currently been on the news right now just because a lot of children have been getting scarlet fever from strep A recently, and scientists don't really know why. Let me know if you have any questions.